camaraderie presenting Understanding Medicare and Your Rights and Options. This is an education presentation. Camaraderie is not connected with or endorsed by a U.S. government or federal Medicare program. Allow me to introduce myself. My name is Ben Washington. I'm a licensed agent. I have experience over 6 years in Medicare sales. The telephone number is 224-433-5754. And you can contact us on www.camaradieagency.com or through our email. Understanding Medicare and Your Choices. In this presentation, you as a senior will learn the basics of Medicare and how it works, your entitlements according to federal laws, your rights, options, and choices. This is an education presentation. I will help you navigate through the confusing maze and unravel the mysteries of Medicare. What is Medicare? A federal health insurance program enacted by Congress in July 1965 under the Social Security Act for those 65 and older, also for people under 65 with certain disabilities, for people of any age with end-stage renal disease, ESRD, or permanent kidney failure, chronic dialysis, or kidney transplant. Let's go back to our ABCs. Medicare is made up of A, hospital insurance, B, medical insurance, C, Medicare Advantage Plan, D, prescription drug plan. The ABCs and D. What service does Medicare cover? If you have Part A and Part B, you can get all the Medicare coverage services listed in this section, whether you have original Medicare or Medicare Advantage Plan or other Medicare health plan. What do I pay for Part A coverage service? Co-payments, co-insurance, or deductible. Many apply for each services listed on the following pages under the original Medicare. Let's talk about the four parts of Medicare. Part A, hospital, hospice, home health care, skilled nursing facility. Part B, physician service, diagnostic services, preventive services, outpatient services, medical equipment, and some prescription. Part C is done by a private insurance company approved by Medicare and cover the same things that Part A and B does, but may include some dental, hearing, and vision benefits. Part D is a standalone prescription drug plan. Medicare Part A. Most beneficiaries do not pay a premium for Part A. Part A is a premium-free beneficiaries if they or their spouse have been employed and paid Medicare tax for 40-plus quarters or 10 years in their lifetime. For those who worked it less than 40 quarters, or a premium can be paid up to $458 per month. Part A, late enrollment penalty, or LEP. A Part A LEP increases the monthly Part A premium by 10%. Beneficiaries are subject to LEP will be required to pay the higher premium for twice the number of years they could have at Part A but did not enroll. Medicare Part A, example, late enrollment penalty. If a beneficiary is eligible for Part A for 2 years but did not sign up, he or she would have to pay a higher premium for 4 years. Deductible under Medicare 60 days benefit period. Part A deductible must be satisfied for inpatient costs covered before Medicare begins to pay its share of the cost. Once the deductible is satisfied, Medicare beneficiary will typically pay 0% of the Medicare approved amount of covered Part A services. If Medicare beneficiary is in hospital after 60 days, then the Medicare beneficiary pays $352 per day while Medicare covers the rest of it. And after 90 days, co-pays double to $74 per day in hospital. After 150 days in hospital, Medicare covers nothing. There is no maximum out-of-pocket limit for the beneficiaries. Medicare Part B. Part B late enrollment penalty, LEP. The Part B LEP increases monthly Part B premiums by 10%. Beneficiaries subject to a LEP will be required to pay a higher premium for twice the number of years they could have had Part B but did not enroll. For example, if a beneficiary was eligible for Part B for 2 years but did not sign up, he or she would have to pay a higher premium for 4 years. Although for Part B premium amount is based on your income, your penalty is calculated based on your Part B premium. The penalty is then added to your actual premium amount. Part B cost shares. Deductible on the original Medicare a calendar year. Deductible must be satisfied for most Part B services before Medicare begins to pay share of the cost. Most covered preventive services are not subject to a deductible. Once deductible is satisfied, Medicare beneficiary will typically pay 20% of the Medicare approved amount of covered Part B services. If provider accepts the Medicare assignment, beneficiary pays $0 for the most Medicare covered preventive services. There is no maximum out-of-pocket limit for beneficiary cut under original Medicare. Medicare Part C, also known as Medicare Advantage, Medicare Replacement Plans. All of Part A and Part B benefits are obtained through the private plan. Cover all services that original Medicare covers, except for hospice care. Hospice will be covered by original Medicare. May offer extra coverage such as vision, dental, and hearing. Most include prescription drug coverage, Part D. Medicare pays a fixed amount directly to the plan for members' care on a per member per month basis. Plan must be approved by Medicare annually. Continued coverage in a specific plan type is not guaranteed year to year. Medicare Advantage plans are not supplemental coverage. Medicare Part C eligibility. To be eligible to enroll on a Medicare Advantage plan, the beneficiary must be entitled to Medicare Part A, be enrolled in Medicare Part B, live in the plan service area. If the beneficiary is currently paying additional premium for Part A and or Part B, the beneficiary must continue paying this premium even on a Medicare Advantage plan. Medicare Part D. Part D is prescription drug coverage and is offered to everyone with Medicare. To get a Part D, the beneficiary must join a plan run by an insurance company or other private company approved by Medicare. Each plan will vary in cost and coverage drugs. The Part D plans can change from year to year. The Part D late enrollment penalty, LEP. There is a late penalty premium for not joining a Medicare Part D drug plan. When the beneficiary first becomes eligible for Medicare, how's that calculated? It's 1% of the average monthly premium times the number of months you're late, equal to the penalty. For example, if the average monthly prescription drug is $33.19, the penalty fee will be calculated as 1% of $33.19 multiplied the number of months late. Enrolling in Part D, if beneficiary was 12 months late enrolling in the penalty, would be $13.98 paid on top of the drug plan's monthly premium. A Medicare Part D can have 4 phases of cost. The first phase is called the deductible phase, in which the member pays the retail cost of the medication until they reach the deductible. Then they move over to the initial coverage level, but then the member and the plan pay their share of costs until you reach the initial coverage level, and then you move over to the coverage gap. Most Medicare prescription drug plans have a coverage gap, also called the donut hole. This is a temporary limit on what the drug plan will cover for drugs. Not everyone will enter the coverage gap. The coverage gap begins after the beneficiary in the plan has spent a certain amount for covered drugs. Most Part D plans are subject to the coverage gap. And then once you reach the level for the coverage gap and limit, then you get over to the catastrophic coverage. And once you get into the coverage service phase, then you pay a lower cost for the medication.